Hello, this is a training on CFS's guidelines for community safety to prevent exposure to COVID-19. It's important that we all take the necessary steps to reduce risk of exposure, and as we're looking at gradually returning to the community, there are ways that we can minimize risk while being in the community. So we put together some important information for you to be mindful of and to follow moving forward. It is important to note that as information does change pretty regularly, we have been updating our website, cfsny.org. We have a COVID-19 page, and I highly recommend you visit the page regularly and to check there for any updates or questions you might have. Okay, so just a quick CDC clip of a video that about social distancing means putting space between yourself and others, and everyone can help slow the spread of COVID-19. Okay, so the first step is before going out to the community, we want to be sure to have a plan of where you're going and how you are going to travel that is the safest route, again, to reducing risk of exposure. Have you called ahead to determine if the location is open for business? Do you have supplies that you need for yourself and the individual you're supporting, such as hand sanitizer, a napkin, disinfectant wipes, or a paper towel, a mask? Do you have for yourself and for the individual you're supporting? And in addition, it's important to prepare yourself. In addition to preparing yourself and the individual with supplies, you want to talk about what to expect. For example, you want to educate them on the fact that there might, what social distancing means, and that if that can't be established, that you might need to leave the community to head back home. You want to educate the individual on appropriate safeguards that they will also need to follow as well, and to help them to reduce the anxiety that they might experience by knowing what to expect before going out. Hand washing, super important. We do have on our website a hand washing video. You might think that you know how to wash your hands properly, but again, this is unique times that we're in, and washing hands needs to be done vigorously. Needs to be done for 20 seconds, and as a helpful way to think of what 20 seconds is, you can sing happy birthday twice. You need to use warm water and soap, and use hand sanitizer only in the absence of soap and water. Okay? When interacting with frequently touched surfaces, such as door handles or handrails, it's recommended that you use a paper towel to hold the handle. If you can't, then definitely wash your hands after touching those frequently touched surfaces to reduce risk. Staying home when sick. All of us, it's important that all of us stay home if we have symptoms of COVID-19, such as a high temperature, cough, or respiratory symptoms, and follow the necessary protocol. We have more information on our website for our employees who have symptoms or who have been exposed to someone. It's important that you communicate immediately when that happens and that you follow those protocols to, again, reduce risk of exposure. Coughing or sneezing into an elbow is important, or into a tissue or paper towel, which you discard immediately. And limit the touching of eyes, nose, and mouth with unwashed hands. We're all surprised at how often we touch our face, and it's important to be mindful of when you're doing that. That's a good way to reduce risk. Face coverings. We should all be wearing face coverings at this point. You should have access to face coverings that we have supplied to you as employees, and if not, you need to contact your supervisor for us to send that to you. Wear face coverings when you're in the community. And this is to, it's required at this point when you're in the community and you cannot keep social distance. So if you're going to be near within 6 feet proximity of others, it's required that you wear a face covering. But we are also requiring that you wear a face covering at all times when you're in the community and any time that you're supporting the individuals, unless there are exceptions that we'll discuss. Okay, it's important to ensure that your mask is covering both your nose and mouth and is secure to the face. Face coverings include a cloth mask, a scarf, a surgical mask, or an N95 mask. And it's important to take care of the masks in between use. We have also on our website specific information on how to take care of an N95 mask so that it can be reused for a period of time. Same for a surgical mask and a cloth mask. So it's important that the mask is fitting you well, that it's clean, that it's not damp, so that it can help to reduce risk of exposure. Okay, and here's just another image from CDC. Okay. Social distancing. So this is key. And maintaining physical distance between you and others helps greatly to reduce the risk of exposure. And that means to stand 6 feet apart. Avoid close contact such as shaking hands, hugging, and kissing. If you're waiting online, like let's say you're shopping, you want to make sure you're 6 feet away. And if the site that you go to is not maintaining these safety practices, it's important that you leave. So what does 6 feet mean? So 6 feet, if you think about two adults standing next to one another with their arms outstretched, that's about 6 feet apart. So if you have two adults in between you with the arms outstretched, that's an indicator that you're good. If not, you might need to leave or try to establish further distance. Okay, so this we're sharing with you just a few helpful reminders, ways that you can evaluate risk. Okay, so 3 ways to evaluate your risk of exposure, which would be 3 areas that when you're out, you want to take a look at how many people are present and what's their proximity to each other. So if there are too many people to maintain good distance, then leave. The second one is there an ability to wash or sanitize hands? If there is a need to touch surfaces and you do not have the ability to wash hands, then leave. Are people wearing masks and gloves if necessary? And if people are in close proximity and not wearing appropriate face coverings, then leave. Cleaning surfaces. It's important to clean surfaces at home and in the community. We have a more detailed list of how to properly clean at home on our website that you should review. That's good for everybody to use. When cleaning, use soap and water or a bleach and water solution or an EPA-approved household product to clean surfaces. You can also make a cleanser with a mixture of 1 cup of unscented chlorine bleach and 5 gallons of water. And this is important as we talk about community as well. Transportation. Be mindful of social distancing on public transportation. You want to assess if you're able to be 6 feet away from others, and if not, wait for the next train. Be mindful if you're touching surfaces, that you disinfect your hands or clean afterwards, especially surfaces that people touch all the time. If you're taking many sources of public transportation, you might want to consider bringing a change of clothes again to decrease your chance of exposure. If driving a vehicle, wipe down frequently touched areas and surfaces such as steering wheels, door handles, radio, and window buttons, and you want to do this before and after each use. Here's another nice CDC visual of the key important areas to think of when traveling: keeping social distancing, washing hands or hand sanitizer. And when you return home, it's important to remove your shoes And determine if changing your clothes would be a good idea, especially if you've been riding public transportation and might have come in contact with a lot of surfaces that are frequently touched. Wash your hands with warm soap and water as soon as you return home, and clean or sanitize frequently touched items such as your cell phone, your keys, your purse and wallet, and your face mask or covering. And if you've been to a high-risk location like a doctor's office or hospital, you might even consider taking a shower and bagging or washing clothes. And here's the checklist I mentioned, so things that you want to do on a regular basis, and it's our wish that this becomes habit, that you always think of what are you going to bring with you before you go out, and do you have your hand sanitizer, do you have a paper towel, do you have your mask? What should you do at all times when you're out? Are you maintaining social distance? Are you wearing your mask or face covering? And have you been washing and sanitizing your hands regularly after touching surfaces? And lastly, when you come home, have you washed your hands and have you sanitized your items? So these are all ways that you can really take these steps to reduce risk of exposure. Again, there's a lot of information. We just wanted to highlight the most important key points that will help you and all of us to minimize risk while we're out in the community. For more information, visit our website, our coronavirus-alert page. Thank you very much.